You know what?
It doesn't have to be this way. Corrective chiropractic care is a measured approach to reducing the stress in your body that is literally sucking the life out of you. So Lisa, when you decided at that health show that we were at to come and give me a chance to drive all the way up from Santa Monica, can you just say what your experience was like and how it was different from what you've been doing up until that point?
I had tried a lot of different things. And I think when you were going through your list here, mine was, it's just 4 Advil, Lisa. What's the big deal? You're going to feel better after 4 Advil, and that would take the pain away. What was happening is I was getting shooting pains down predominantly my right arm, and across my shoulders and down my right arm. And I was working a desk job at the time for the most part, and those are painful. And if everybody knows that pain if you've experienced it, and you'll do just about anything to get rid of it. And when you told me that you didn't twist and that you were very holistic, I thought, I can do this. It's worth my time, because it was getting to where the 4 Advils I'd have to take them a couple times a day. And they weren't working. All right, and regular adjustments weren't working anymore. And that's why I came to you.
Okay, well that's great motivation. I mean, the next step, if you hadn't found me, the next step would, for the overwhelming majority of people, would be get a surgical consult.
And that's what it was being suggested, is I might need surgery on that. And you told me I wouldn't need it. That if I would come up 2-3 times in the beginning of a week, then it would prevent me from having surgery.
And this is 3 years later.
3 years later, and I don't have those pains. I've learned to carry my stress in a different area, and I'm in alignment there.
Nice.
That's great. And, it's amazing. So many people work at desk jobs. When we were out in the public and we're screening people, one of the questions we ask is what they do for a living and how many hours per day they're stuck at their desk, because that just gives us such a huge red flag as to some of the problems that we can expect to hear that these people are having.
Yeah, I had developed a hump on the back of my neck.
Oof.
And if you use the phone and you have your phone up to your ear and you're trying to write, you're going to develop that. If you're not sitting straight, I don't have that hump anymore.
Yeah, and
that's huge.
Awesome.
Huge.
Yeah.
Excellent. Unfortunately, we're seeing that in children now.
Yes.
We never used to see this until the mid-30s. We're seeing it in children now because of all of the gaming devices, and it's called text neck now. It used to be called forward head posture, military neck. Because of the vernacular of the time, it's text neck now, where during the growing phase of these children's, bodies, they spend almost all of their time with their eyes down in their lap, and it's a real issue. It's a real issue. When it's just from an injury, it's easy enough to rehabilitate in an adult. But when the children have actually grown that way, it can be a problem. So we have some, information that we work with our patients who have children that are already exhibiting signs of this and get it corrected early on instead of trying to deal with it after their skeleton is fully formed. In the wrong position.
That's amazing.
Yeah, it's a little scary, but another reason to come to a corrective chiropractor instead of just get treatment only in a crisis emergency.
Right.
Because it can change the quality of your life.